Dr. Askew, are you on the line?
Hello, how are you?
Good, how are you?
I am fine, thanks. I am on, and thank you everyone for joining us today. First and foremost, I want to bring you greetings from the county executive. She is just finishing up a press conference whereby she was responding to what many of you saw yesterday, the governor's press conference where he establish an opening up of the government of Maryland fairly broadly, including retail and churches and other operations that very clearly, and he recognized it and even said so, that some areas are not quite ready to do that. Montgomery County and Prince George's County in particular, Baltimore County and Baltimore City also made it very clear that they're not quite ready to go into this phase one. It doesn't mean that we're not on the right track. We are on the right track. We're following the parameters that were set by the governor, reinforced by the county executive, and what the county executive has decided to do and just announced in her press conference, and it's actually quite relevant to the discussion we're going to be having here, is extended our stay-at-home order until June 1st. So we're going to be extended until June 1st. It doesn't mean it's going to last until June 1st. It's possible that we could reach the parameters that we need to reach by then, before then. But for the time being, we're planning on being in a stay-at-home situation until June 1st, which just further exacerbates for many of us, many of those we work with, our friends, our families, our children, the stress and strain of being, in a sense, cooped up. This is not a normal human condition. We are not creatures who like to be corralled. We are not creatures who, in most cases, function well in isolation. Isolation is used as a punishment for people in many places and in many countries. And this isn't meant to be a punishment. In this case, it's about saving lives, and it's actually an act of love within the county that we're able to do this. But it's not the kind of thing that we're used to, nor respond well physically, emotionally, mentally, and it is quite a challenge. So my appreciation to Carrie Ann Peart and our other colleagues in the health department, our colleagues in the county executive's office who put together this webinar series, which is addressing many of the issues that we're all dealing with, issues with children, issues of our own isolation, broad issues of mental health that really, as I said, have been exacerbated by the conditions that we're currently under. So thank you all for participating. I know that we have Dr. Shaw on and available, who is tremendous asset. I keep telling her how wonderful she is, and so I hope it doesn't go to her head, but actually I do hope it goes to her head because it's true. But right from now, I'm going to turn it back over to Carrie Ann. And again, Carrie Ann, thank you so much for all the work you've done in putting all this together.
Thank you. Thank you very much, Dr. Askew. So I want to make sure that folks can feel free to drop questions as we go through this presentation in the chat box. You can raise your hand if you want me to unmute you, if you have a query as well and want to say it verbally. If you're having issues hearing us, as I see somebody messaging, try and log off and then log. Sometimes it just depends on the server that the mode that you're in. So try and log off and then log back in and see if that helps to revive your sound and tinker around that way. All right, so Dr. would you like to go ahead and do this afternoon's presentation up, and then we can get going that way? Or
okay, so thank you guys for staying with us. For those who have stayed with, so those, I know that several of you were the last one, and especially because the press conference was at the same time, that we assumed that there would probably be some people that weren't on the prior calls. I'm going to try to go quickly through some of these little bit just to give us a framework and then open it up for questions. Thank you, Dr. Askew, kind words, and thank you to Carrie Ann and the rest of the committee for putting this together. And I'm just going to speed along. Okay, so this, like Dr. Askew was saying, is it's an unprecedented time. And although this is we think of this as a medical, a primary physical medical condition that's leading to this global viral pandemic, this will lead to a behavioral health crisis for us if we don't manage this now. And the key to managing this, managing our stress and managing our behavioral health in the midst of it, and making we are as healthy mentally to go through this. So, and even though we're talking a lot about the ventilators and COVID-19 and the lungs, and I'm a physician, so I get it. We have to make sure we have that oxygen. But being alive is not the full extent of living. And living, just sort of generally, it's a holistic state of physical and mental health. And these are difficult times for all of us, and for some of us more than others. And we have to just acknowledge that and be able to focus on being deliberate and intentional and maintaining our mental health, and not feeling ashamed of going through that. Like Dr. Esky said, we're designed to be active social human beings, and if we dismiss that or disregard that, we're going to have ongoing issues. So stress responses can cover the whole gamut between appetite, sleep, hair, fidgetiness, and shortness of breath even. Although I just want to if you're having medical concerns like shortness of breath, to make sure you're still discussing that with a healthcare provider and not assuming that it's anxiety. This infographic reminds all the organ systems that are affected by stress. And I just want to remind us that immunity in our immune system is impacted by stress. The stress hormones, when they go up, it affects our body's ability to fight an infection or go into overdrive and fight an infection in an improper way. So that's important for us to remember, is that our mind and our body are connected, and we are not just splurging or indulging in taking care of ourselves mentally. That this is actually a core component of taking care of ourselves holistically and physically. And so we are going to go into coping strategies, and just briefly, I just had a quick summary of what we did last hour, and that includes our body, mind, and spirit. And with our body, the same things that we need to do to prevent coronavirus are the same things that we need to maintain our mental health. So that includes exercising well and sleeping. Those our bodies rejuvenate, they build up our antibodies and all that works through sleep. That's why our bodies get fatigued when we get a virus. When you have your body starts to get fatigued, it's because it says, I need to take a break. I need to get into recovery mode. It's giving us a cue to get into recovery mode. And that's why I sped by it, but early on about all of that laundry list of anxiety, and because we need to make sure we're in cue with our body and listen to our bodies to get the appropriate help that it needs, whether or not we can do it ourselves or we get help from others. And then the other piece is relaxation and self-care activities, whether or not that's taking a bath, a hot bath, putting on an app with the relaxation, like there's an app called Calm there that has these background noises and things, like doing things to just to break up the sensory ideas of being at home. A self-spa time. So if you used to do every 2 weeks, then this is probably thing. But take some time to do your own. I know it's easy to get into the groove of not getting really dressed or not getting as dressed for work as you used to, but getting dressed and making yourself feel good and by looking is, good, but not getting caught we just had this in the last discussion, not getting caught up in the I wouldn't say vanity of it, but just the getting caught up in having to look in a specific way, but just doing enough to make yourself feel good and make sure you're reminding yourself that I'm taking care of my body on the outside. Deep breathing. My theme here is that YouTube is one of the best therapy tools that we have nowadays. You can just YouTube a deep breathing activity or deep breathing meditation, progressive muscle relaxation, and get some cues and scripts with images and sounds to help to encourage decreasing stress and staying relaxed. And that just progressive muscle relaxation, I like to give a little cue. Let's just do it together. If we think about everyone, close your eyes very, very, and then you want to tighten your hand and feel like your fingernails getting into your palm of your hands, tightening your arm, tightening your bicep, tighten your shoulder, and then with just one arm, slowly release those muscles in the reverse. You do something like that even if it's 5 minutes because you have to go care to or whether or not you can do that for 15 minutes, that or an hour, that you think to just make sure you stop and take an inventory of your body and try to correct the tension before it gets overwhelming and builds up too much. Coping in your mind. Both optimism and anxiety require us to imagine something that hasn't happened yet. If we have the ability to worry about the future, then we have the ability to imagine a better one. I love this quote that I saw a couple days ago. I think that it reminds us that we can stay present and we can stay, and when we stay present, we have the ability to either use our mind and our limited mind resources to go in the future in a negative way, in a positive way. And when I've heard this with respect to spirituality and prayer, that you can take worries and change them into prayers, but it's all about our perspective. And especially now with this illness, there are ways that we can look at it. We can look at it with the respect to staying engrossed in the negativity and the risks and the losses and deaths, or we can also look at it with respect to the, we can also look at it to also staying focused in our future and seeing the good in this situation. There's good to be found, even though this is negativity. So stay connected, schedule social time, make sure that we are intentional in not being socially distant, but being physically distant, but not being social distant. And make sure that you're talking about stuff that's not, and because all of these things are just really important in making sure that you that we're not feeling lonely. Loneliness has negative effects that can even that can lead to earlier death. So we need to make sure that if we are feeling lonely, that we can be alone, but not lonely.
The what section?
It says that we reach out to other people. Have a virtual book club, stream a Facebook party, do Netflix watch parties, whatever it is, but schedule it. Put yourself in control and create a schedule socialization, schedule self-care, schedule breaks, and safely do things for others. It's not just saying thank you to the person at the grocery store in a sincere way and just looking them in the eye, or the UPS person just making sure you say thank you, and then breaking up the monotony of being at home. Are there little things that you can do around the house just to try to make things a little different? You can use guided imagery to try to get yourself to escape, but do you sleep in the spare bedroom just to try to get yourself in a place that's just to get a little bit out of the rut?
Yes.
Find meaning for this time, and the spiritual coping sense can be very important. Pray, meditate, join an online prayer group or line if this is all of, if this is spirituality is an important part of your self view perspective, because we know that religious coping and spiritual coping are very impactful for improving mental health outcomes. And then also make sure that we maintain our our faith-based social connections, because we know that we've lost them by not being able to attend, but we want to make sure that we're still maintaining that connectedness with the people and not just the spirituality component too. To talk a little bit about just coping if one is ill. I think that this is, stay focused on the present and staying healthy, and stay out of the news coverage when you're sick. Worrying or harboring angry about how, or being guilty about how you got it isn't to get you any better. It actually, like we talked about, stress making you possibly worse. And then feeling guilty about your pre-existing health status. If you're a little overweight or have high blood pressure, something of those lines, and then you feel like you're at higher risk and you're now sick, then don't beat yourself up over it. That's not the time right now. You're getting healthy, and don't hold guilt about anyone that you might have unknowingly infected. Stay hopeful. COVID is not a death sentence. We have a great healthcare system. We have hospitals working diligently and medical professionals working diligently to care for the health of the who are sick, and our bodies are working diligently and have a strong immune system, and many don't need medical. Statistics aren't absolutes, and focus on the good. If it's been 2 days without a fever, then focus on that, but not to or refuse the ability to seek medical care because of you're trying to stay too optimistic. But hope is just so important, and I just want to maintain that. But also, with all that hope, still get help early, because you can also have hope in your body and in the medical system and the people that we have around us to help. So as far as help is concerned, you're not alone. So we're not alone, and actually there's a question in the chat right now that I'm going to get is about stigma and in the African American population and seeking help. What do people know? And so, first of all, behavioral health care is available, and I think what people need to know is that everyone's going through something right now. If you are not having some type of depression, even a fleeting here or there, then you're not normal. And the depression and anxiety that we're experiencing as a society is helping us to have that active love in social distancing. It's helping us to have empathy for others. It's helping us to protect ourselves and our loved ones. But if you are stuck there and you can't function, or you have suicidal thoughts, turning to alcohol or drugs, then that's problematic. And so with that, we want to just remember that you can contact 211, dial 1 to get help in the state of Maryland. Text HOME to 741-741. The 211 website is there available as well. And you can get treatment at home without telehealth. So with telehealth. So I think there's a fear about getting any type of medical care right now, including behavioral health, because there's a risk of getting the virus or getting out there in the community. But the government and the state government and our local providers have rapidly switched to telehealth platforms so that they can continue to provide service. So that other great thing about this is that this also can decrease stigma, because you're doing this out of your own home. But I think that we have to make sure we are prioritizing our health and mental health, and reshaping the narrative of stigma from being a source of weakness to being a source of strength and courage to actually do something about it. And because it's a source, you're moving these feelings into action, and that's actually very important and impactful, I think, as far as stigma. The other piece is that, frankly, if you think about stigma and African Americans and seeking help and therapy, that, as far as seeking help and therapy, that there are communities that will pay for getting therapy just because. You know, if you are in New York City, and you have a private practice, psychiatry practice, people are paying, you know, celebrities, whoever, are paying several $100s with no mental health diagnosis and no need to, with no mental health diagnosis. They are just saying, I just want to make sure that I'm the best person I can be, I best understand myself, and I can best navigate the world. So that's true for people who are coping possibly somewhat well, or maybe not. And so we just had the slide about how to get help, but and we can go back to that. Thank you, Carrie, for putting that in. You know, if you have insurance, if you have medical insurance, call the number on the back of your insurance card, and you can get some information about providers in that way. Through 211, you can get affiliated with our with the affiliated Sante group and our Prince George's County Crisis Response. They are doing therapy. They have therapy appointments, and they have an urgent care center. You can also, those are the key pieces if you have insurance. If you don't have insurance, call 211. There are also federally qualified health centers that provide care as well. So there's a myriad of ways. And the other piece to that too, as far as seeking help, that sorry, it's difficult to look at the chat and talk at the same time. But the 211, the insurance card are the key ways. Our county crisis is available. And actually, what's discouraging for me, or disturbing for me, is that our Prince George's County Crisis has actually said that they've had a decrease in calls for mental health concerns. And we know that this is distressing from a mental health. So I just like the county executive mentioned in her last conference, not the one today, but that there's been a decrease in emergency room visits for things like heart attacks and strokes, and that, you know, the medical system is available to you. I encourage people that the medical system is available, and that is for children, adolescents, and teenagers still to help, and that you feel like we have to suffer alone or suffer in silence, and especially out of fear. So just in summary, this is a stressful time for everyone. Some symptoms, but extreme stress is not healthy. Your immune system is affected by stress. Stay physically distant, but not socially distant, and be deliberate with your mental health coping skills, and seek help when needed. And this is my final little slide, just to remind us to not be okay as long as you're not giving up. So I know that we had some.
Yeah, we have quite a few questions in our chat that I know you saw coming through. One of them definitely that sparked my interest to hear your response on is that question about African American health, particularly mental health, and the stigma around that. How would you suggest we tackle that, particularly considering the state of affairs right now?
Sure. So first of all, I want to remind us that you know, physical health and mental health are very similar in many ways. That we have so if your blood pressure is high, then we don't have that same stigma about going and getting help or getting treatment. And that we as African Americans in this country, and also in really Black and brown people, or people of different types of the different types of backgrounds that have been marginalized in our society, have faced historical years of racism and faced histories of just adversity. And that adversity, you know, eventually gets to us from our physical and mental psyche. And so I think the first thing is to realize that it's that we are not just facing now, we're facing our past. And this now is just adding on to that history. And we cannot disregard that because our future is going to be impacted by it. So if you're an adult and you're feeling the stigma and you have children around you, I want to remind people that children are the most important predictor of a child's mental health is their parents' mental health.
Mhm.
Children take on the cues and social cues from adults. And just, they're magnets. They pick up on it. They sense the fear, and they sense the anxiety. They sense the stress. And so, first of all, sometimes people want to stay focused on themselves and feel like they're guilty. They should feel guilty about themselves. It's about others. It's about making sure that you're as best as you can be for society. It's the best as you can be for the other people around you. And so we can't get stuck in the stigma because it's not about us. And then we have to think about the past is still with us. Other people, majority populations are seeking behavioral health treatments and mental health treatments at higher rates. And just because they have access to it, because they have the money to do it, and they want to just discover themselves. And so to do things just to discover themselves and may not even have problems, then why can't we? Why can't we just say that we want to make sure that we're the best we can be? And I think that there's been a shift, especially in young people, about mental health and stigma, just knowing that that it's okay to seek help. It's been a cultural shift with the young people. So I'm very thankful for that.
There was an
Dr.
extension. Oh.
I just wanted to add a little bit to that. One of the things that I've seen that has worked well in other communities, other municipalities around this issue is elevating it to people who are looked upon as either leaders in the community or figures that you kind of figure have it all and everything's okay. And when they come out and say, hey, you know what? I go to a therapist once a month because, there's an issue that I was dealing with and it's completely helped me and made me the person who I am. Or, when you can point out to folks actually that either yourself or someone or someone you're close to may be suffering from a mental health issue or has a mental health issue. And we, in a sense, we normalize it within the community. But when we see folks that look like us who are talking about the issue, I think that helps a great deal. And so that's one thing that, as we look forward to how we want to address this issue when we're thinking about our work around Healthy and Well Prince George's 2025, that may be something that we will incorporate into some of the activities that we do.
Thanks. Yes, like Taraji Henson.
Yeah. So there's another question about, I'm a mental health or behavioral health provider. How can folks know that I'm available for telehealth therapy? Is there any way that we can?
So there is a list. There's a list of telehealth providers in the county. The local behavioral health authority has created a list, and we have that at the call center for the coronavirus. But that is and we have that list, and you can also reach out. There's also, it depends also on the your insurance status as well. I think a lot of people are looking as well for the insurance piece too, and making sure that people know that there's a variety of insurance providers that can provide that information. So we have that information available at the call center. If people call and they're seeking help,
And that call center is still the 211?
Sorry, through 211 or the insurance, but then also our coronavirus hotline, we've made sure that we have given them the information on behavioral health providers too, if people are feeling that they need help. And then also the coronavirus hotline call center. But then also, in addition to the coronavirus hotline call center, we have when people are getting screened, we're looking at how to integrate mental health assessments and or at least a screen as well to see if people are distressed or discouraged. They've been identifying people and directing them that way. But if you reach out to Carrie Ann directly and give us your information, that we can also make sure that we you on those applicable lists.
Yep. Please email me and I can make sure that I send that information out to you. Another question with that, I guess on that same front, so if I want to seek mental health therapy or emotional support through telehealth, don't have insurance, how do I go about getting those services?
So if you don't have insurance and you are eligible for receiving Medicaid, then you can actually start that process without being active. So you can actually, the provider that would be providing the service will get paid as if you have Medicaid already. And so that helps to encourage people to get into service quickly. If you are not eligible for Medicaid, security number or undocumented, that's the next question, then federally qualified health centers also provide some mental health services as well.
Right. Okay. And federally qualified health center information can be found on the website, our health department, our county health department website. You can find that information there as well. I know Nona has had her hand up for a while and I was asking her what her question was. Nona, can you unmute and ask your question, please?
Yes. Well, the first question, I did not hear the gentleman, I didn't hear all of the gentleman's talk earlier. Did he say Montgomery County and PG County are not opening till June 1st? Is that what he said?
That was Dr. Askew, and I believe that June 1st is a date specifically that we're targeting for our county. Dr. Askew, Montgomery County also on June 1st?
Yeah, well, we have said that as of today, the county executive has put in a stay-at-home order that will last until June 1st. Now, the caveat to that is if we see the parameters that we hope to see with the number of cases going down, hospitalizations going down, fewer people in the intensive care unit, then that could end sooner than June 1st. But that's the date we're targeting currently. Montgomery County is doing the same thing with respect to looking at metrics. In other words, looking at numbers and looking at the data to determine when they will open. They have not set a date. They're essentially looking to meet the same parameters that we are setting to meet, but they have not set a date as to when they would extend or lift their stay-at-home order. They're essentially saying, until the numbers get there, we're not going to entertain a date at all.
And the second question that I had related to mental health and stress levels. If your mental health or your stress levels are fine, how do you help family, friends, colleagues? How do you help other people deal with stress? Because sometimes other people's stress can, of course, impact your stress levels. So any tips on, helping other people cope, or any tips on preventing other people's stress levels from becoming your stress levels?
So those are two good questions. So I think the first piece is to make sure that you're focusing on you staying healthy, and that if you do feel overwhelmed by someone else's stress, then you make sure that you are
this is the Aaron County Health
your
Department.
own health as well. So that's one key piece, is to know your own limits and don't go beyond those limits. As far as the mental health of others, that you want to show concern. You just want to show a genuine degree of concern and help them, just as the same way that I had that very brief list of symptoms, and I'm noticing, just to have a discussion, I'm noticing these things, and I really think that you're really great at XYZ, and I've noticed that you're being a little bit more forgetful lately. And sometimes people who are more forgetful are more stressed, or even having more headaches lately. And I think that people who have more headaches are more stressed. And and you can start with, do you want to talk about it and understand how they feel about it? But then if it becomes and then you gradually can broach that idea of getting help. And if you can do it gradually. If they're obviously unwell to the point where they are having acute suicidal or homicidal ideations or something like that, then you do want to then quickly direct them to or a crisis line. So I do want to make sure that we touch on that. But you do want to just, first of all, express concern and then encourage them. You don't want to say it in a pejorative way or a way that is saying that they're failing and they're doing poorly. You don't want to say it in a way that is accusing them of not doing something right. But I think that we can start saying it and saying that we're all struggling. And I'm just noticing that you're having a little bit more difficult of a time. And I want to make sure that I see you succeed and encourage them.
Hi, this is Dr. Askew again. Thank you, Dr. Shaw. Another avenue that we're exploring and we have explored, of course, COVID has really knocked us all for a loop in many respects, was something called mental health first aid. And it really, just like it sounds, just like we talk about physical health first aid, mental health first aid is really a way to train lay people, folks who don't normally deal with mental health issues, to help provide sort of appropriate first aid and care and response to people who they are concerned about. Again, this is something else we'll be looking toward trying to expand, not only within the county sort of workers who are frontline folks, but really trying to get it into the community. Again, another way to destigmatize mental health is to make it so that everybody is, as many people in the community are trained to recognize, respond to, and help folks who are either entering into mental health crisis or just a little bit of escalation in behaviors that are concerning. That's a very important question, and I'm glad you asked it because it's a great reminder to us about some of the things we need to try to put into place.
So I want to keep going through some of these questions because there's some really awesome questions coming through. So one question was, is there a space where seniors specifically can call in for senior emotional support and mental health servicing? Do we know?
I am not aware, and I know that the local behavioral health authority is on this call as well, and they might have additional input. I am not aware of a senior specific hotline or capability for calling.
Okay. I'm guessing folks can just email me and
email
we can
you,
find out. Yeah.
You can find out. Yeah, the Department of Aging.
Yes, that was the other one I was thinking that probably.
They,
AARP is a good resource. That's very true. I have my AARP stuff. But you guys can email me. I'll keep putting my email in here so you can see it. Dr. Askew, here's a question that I think you could help communicate. It's related to COVID-19 numbers in the county and why are they so high?
Another great question. It's been made very clear to us by the Maryland Transportation Institute. This is going to be an interesting explanation, at least as part of the explanation. The Maryland Transportation Institute is a group of scientists at the University of Maryland who are essentially the world's experts in intersections of travel and interconnectedness between communities. We are the primary hub for travel within the state of Maryland. In other words, we're surrounded by airports on multiple sides. We have 70% of our populace that goes into other counties nearby to work. And they've shown us that since the beginning of March, we have the most imported cases of COVID-19 of any county in the state of Maryland. That said, we also have the unique circumstance of having a large community of folks who are essential workers who are in the food industry, who have continued to have to go to work on a regular basis. We have a lot of folks in densely populated metropolitan areas that have multi-generational households, crowded households that don't allow for sufficient social isolation, social distancing and physical distancing. You know, I like to say that's a privilege that people have to be able to social distance and social isolate, and it's a challenge when you're in close quarters. And we've also done the most testing in the state. We have done 25% more testing than anybody else in the state, which means we're going to see more positives because we are testing more people. So for all of those reasons, you're seeing many more cases here in Prince George's County.
Thank you, Dr. Askew. Ms. Deborah Harris, please unmute yourself and ask your question. Or here we go, I'll unmute you. Unmute you. Ms. Deborah? All right, I'll come back to you, Ms. Deborah Harris, or you can put your question in the chat box. There was mention of crisis train. Do we have staff that's crisis trained in the county? Yes, we do, right? Because we have a specific crisis center.
Sorry, general, I saw one about the police, and then do you mean,
Yeah.
General staff, there's both. So we have a crisis
Trained
team.
officers, yeah, okay.
We have a crisis team, and then actually that team will often respond with to a behavioral health crisis, and that team also does the crisis intervention team, or a standardized training, CIT training for the police as well. So there are teams of people specific to mental health. There are officers that are trained, and that training is looking to be even expanded to a broader array of officers.
Right.
This is Deborah Harris. Ask a question. Are you there? Can you hear me?
Yes, I can hear you now. Please go ahead.
Okay. I really am, first of all, proud, so proud of Prince George's County and our family, of how we have stuck together with our social distancing and wearing masks. I'm really happy about that. Also, I feel that right now at the coronavirus, yes, we have some very hard things that people are dealing with staying in their homes and everything. But I think we have to kind of get back to basics. Number one, I feel that we talk about mental health, and we know that mental health is somewhere in a wall, in a building somewhere. We don't see it. The thing is to get out in the community. Number one, Prince George's County saying to our kids and everybody else, we are dirty. We have trash places that we shouldn't. When you come into Prince George's County from DC, Pennsylvania Avenue and Silver Hill Road, we need some more responsibility there. And being able to get out in the community, get out there, put out flyers or things, stand out there with the community, pass out things, show that we're here for mental health. And mental health starts at the very basic, as having a clean place to live.
Mm-hmm. I agree. Thank you so much for that, Ms. Deborah. I really agree, and could not agree even more. And it does take our community to really be responsive and proactive about that. I know our 311 space of staff are really taking requests seriously when folks are calling in about trash being in certain spaces, or just unsightly buildings or roadways. So please keep calling the 311 space, and I really appreciate you making that charge to us on this call. It's important that we do think about it just outside of the context of being also emotionally and mentally well. Because
yes, I'm asking for a campaign of getting out of the box of being just in those offices and coming out and doing some things in the community. And that's one of the things that's really needed, and it's really needed to see you out there. What is mental health? Some people don't even know. So basic questions, coming out in the community, standing out there, being with people, passing out things, Pennsylvania Avenue and stuff is a place to start saying, we are here, we can help. This is what mental health is, and this is where you go, in fact.
Right.
Thank you.
And
Right,
so we
thank
have
you.
had some prior campaigns, like the Step Forward campaign that was funded with a SAMHSA grant, a federal grant to, we actually had a whole bus shelter ads and a lot of flyers to encourage mental health treatments. Currently, you know, there's going to be some limitation on face-to-face types of promotion of behavioral health care, and but we have had some promotional activities, and we will continue them, and we will continue to target the most appropriate.
Well, let me know where to go. I'm willing to work. Thank you.
Okay, thank you very much, Ms. Harris.
All right, I see another question regarding free therapy to first responders. Oh, Maryland Resource,
Yes.
okay.
So, so yes, this is one of the community providers that is willing to provide free therapy to first responders and other people that are directly on the front lines, and that available there.
Right. And then there's a query about how can we assist the class of 2020, especially the high school seniors, to cope with not having prom and graduation. Yes, I have seen an increase in stuff is not scrolling in depression with this population. Anything you want to chip in there, Dr. Shaw?
So I think that, like I said in the very beginning, we're a human race that thrives on routine and thrives on milestones, and so we're seeing that disrupting those is very difficult. So I think that we have to shift the narrative from a narrative of loss to a narrative of opportunity, right? I've seen some people have t-shirts that say class of 2020 and have toilet paper rolls as the zeros, right? But we're proud of the class that had our graduation with a bunch of stars, and the former president and first lady are honoring us, and we have all of the celebrities that come out of Prince George's County that are coming to honor me for my graduation because I'm that special. And you change it from a narrative of loss and deficit to a narrative of strength and unique, and that I'm going to remember this unprecedented time as one to remember. My college graduation, actually, it was raining like cats and dogs, and it was an outside ceremony to the point where our little graduation hats were all loopy and you could feel the cardboard melting underneath the fabric. But in the hindsight, so it really was not fun that day. But in hindsight, we can look back on the video and say, but you know what? We were the class that had the rainiest graduation ever, and we're proud to say that that's just the resilient people we are. So you change it to a narrative of resilience and strength as from deficit.
Right, that's a good one. And I know also the school system, Dr. Golson's team, the school system is offering support services for students and parents during this time too. So you can always reach out to your specific school principal and ask about guidance, counselor supports during this time, because I believe that they're also ramping those services up for students, which is completely understandable.
They're continuing to provide it via telehealth and other methods.
Yes, yeah.
Very active and still continuing that service.
So A. James, your iPhone, I see your hand up. You can unmute yourself. And I'll try to also unmute you on this end. There you go. You should be able to ask your question. A. James. No? Okay. Again, I'll come back to you when you're ready. A. James, who has their hand up on their iPhone. Dr. Askew, I'm getting some COVID-19 queries about what's the brand of test being used? Why do we not see our numbers being reported? Accuracy of the testing.
I'm sorry, give me that list of questions again.
Sure. Why are we not seeing recovery numbers regarding our COVID-19 cases? What is the brand of testing being used, and what's the accuracy?
So recovery numbers. So the number of people who are getting well.
Yes.
Is that
Guessing that's
correct?
what it is.
We are now just starting to get recently the number of tests that have been done, and that's what is allowing us to now get our sort of positivity rate. So we'll be able to say more about the folks that are getting well. As I said, we've done the most testing in the state, so a substantial number. Most people who get, not, I won't even say it's mostly the vast majority of people who contract COVID do go on to get well and to recover and do fine. What was the second? I'm not able to hold all three questions in my head. So what was
the brand of testing that we're using and its accuracy?
We're doing PCR testing, not antibody testing right now. That's what the question was. What type of testing? The brands they're different test kits. So that would, that's going to vary per lab and region. For instance, the governor has just acquired 500,000 tests from Korea, which will be under a different manufacturer perhaps than some other tests that are being used. But what we're using for the most part are PCR tests that are not rapid, not the antibody test, and also not a rapid test. Many of them, take a couple of days to come back. We are in negotiations with University of Maryland, who their laboratory is converting over to be able to do rapid testing that will get our results back in 8 to 12 hours. And what was that third question?
Accuracy.
The test for the PCR tests are fairly accurate, are very accurate. The antibody tests that we're seeing now are not as specific. They're very sensitive. In other words, they will pick up any COVID material and report it as a positive. They may not be picking up the COVID material that actually tells you that you are now immune to COVID because you've had the disease. So they may be reporting too many false positives right now in terms of the quality and accuracy of those antibody tests. So the danger in that is you don't want to rely on those too much right now until we have better quality of those tests, because you don't want to send people out into the community who you've tested, you've said to them, you've got antibodies, you're no longer capable of becoming infected, when in fact the test is a false positive. In other words, the test has falsely said that you have these antibodies and you really don't. So that's a really great question. So thank you for asking that.
Dr. Askew, that was my question. A caveat to that, I'm wondering, so if you're giving them the test, then are they quarantining for the 14 days, or are they quarantining for a minimum? What is happening after that test is being administered?
It depends on sort of the other circumstances around being tested. If you're symptomatic and you're being tested, at that point we're recommending that you quarantine yourself until your test result comes back. If your test result comes back positive, you'll just continue that quarantine and in fact it goes from being quote unquote quarantine to isolation. There's a subtle but important difference between isolating and quarantining. Quarantine is for people who have been exposed to someone who has had COVID, and we know that they've had a known exposure, and they will be quarantined for 2 weeks to make sure that they don't have it or they don't develop it. Isolation is isolating individuals who we know are positive. We want to keep them out of touch with other folks. And again, it's the same period where we want to make sure they're not infectious. I will say that I won't go there because it gets too much into the weeds, but that was a very good question. But that's the subtle distinction between isolation and quarantining, and why we choose to do both.
Thank you for that, Ms. Tasha, and thank you for answering, Dr. Askew. James, iPhone, I see you again. And
yes, I'm here.
Okay, let's go.
Okay, thank you so much. You know, Prince George's County is definitely a livable community. I've lived in Montgomery County, I've lived in Prince George's County, and by far, Prince George's County is a place to live. The people are wonderful. I have to agree with Deborah Harris, I believe her name was, who spoke about the trash. When it comes to health and wellness, basic things are of necessity is very important to your well-being, and having a clean place for you to come to is very important, as well as finances. And I have called 311 as well as the state road for many years now. For the past 3 years, I know for a fact. I've called for the trash along 193. Never before have I seen so much trash until the construction started for the hospital. All along 193 is just a lot of trash. Now the road is, the grass has grown up, so you can't really see the trash as much. But it is really, really unsettling to the mental state when you drive around and you see that type of, condition. So I really would like whoever is responsible for sanitation to include that as a very critical area of mental health and wellness for the people of Prince George's County.
Great. Sorry.
Secondly, do you want to respond to that first before I go to my other point?
Well, I was just going to say thank you for reinforcing that message around the idea that the environment that you live in has a critical impact on your health and well-being, both physical and mental. And know that the county executive has made beautification one of the pillars of her high priorities since she came on a couple of years ago. She has done many things to make improvements, including enforcing the no dumping in areas, putting up cameras to catch people, find people who have tried to dump illegally in the county, removing roadside signs that are not supposed to be there. I know that Chief Stawinski has on his own gone in his car, in his police car, and pulled signs off of the road and put them in his car. And the county executive, I think she's going to want to hear this, that folks are still feeling like, you know what, there's more that can be done. What more can you do? Keep in mind, I think you made an important point that the county executive has made in the past as well. And that is, many of the roads are controlled by the state. Some of the roads where there's a lot of trash is controlled by the state. We take that very personally as Prince Georgians, as a slight to us as a county if the state is not cleaning our roads as well as they're cleaning roads in our surrounding communities. So know that she's been on their case about this, but your reinforcing this will help me bring back that message to her. And I will also talk to my counterpart, the Deputy Chief Administrative Officer for these government services, Floyd Holt, to make sure that he's aware of this messaging as well.
Okay, thank you. Secondly, when it comes to and I'm not a mental health expert, but I am an expert in being a mother, and I am an expert in, just trying to live a healthy life with abundance. And finances is one of the key things, and I think it's just not enough. I know everyone has their own personal responsibility, but when it comes to finances, it would be nice for the county to include personal finance in, as one of the areas that could be focused on. And one specific area for me as a mother is a Parent Plus loan. I am paying $10.98 daily on the interest on Parent Plus loan. That doesn't include the 7-point-something% interest rate that is, I don't know how that is the case, but I've had a loan for years now, 35,000, and now it's gone up to 47,000, and I pay every month on that loan.
So
Something is wrong.
So, you know, so one thing as far as the student loans and the current crisis that we're in, and to stay focused on that, is that there have been some federal provisions around student loan interest and deferments and forbearance. And so right now, especially in this time of crisis, that I would encourage anyone who is having any type of resource limitation issue, whether or not I was seeing some people talking about in the chat or about the student loans, just to continue to seek help, to make sure that you are addressing that with the direct lender. So, you know, like you say, mental health and your basic needs are highly tied. And I think especially during this period, that lenders are, I think, more open to forbearance and other types of you know, deferments or assistance. You know, we can't really go into the details of a specific loan issue right here on this call. It's a little outside this call, but I know that there have been people also talking about housing and rental assistance. And, you know, I think the basic tenets of mental health are making sure that people have what they need. And the county executive has worked to make sure that there are programs in place for those types of resources. And if there are needs that are not identified, like Dr. Eskew has mentioned, that the more that people make other people are aware of them, then there can be more of a social drive or push to address them. And so just with respect to mental health, I think I would want to encourage everyone to seek help, whether or not that's seeking help for money for rental, or seeking help for money for student loans, and also from a government standpoint. And then also, I think the good thing about this crisis is it brings us together as a community. It's very awesome that 140 people are together thinking about mental health in the middle of the day. And that it might be, you know, as far as bringing together a community, asking somebody if you're sick for a meal to come, you know, so you can drop off something, or saying that I'm a little too stressed, I'm a little too anxious, and reaching out to someone, I think I need help from a peer. But I think that there's a role for government, a role for community, and I just want to thank everyone for coming together as a community on this afternoon to discuss these issues. And, you know, if you have any additional questions, so definitely ask Carrie Ann. And I've been responding to some individual needs too. But it's awesome that, you know, people are bringing up resources that they have to provide in the chat too.
Yeah.
It just goes to show that we have to do this together as a community.
Yes. So out of respect for everyone's time, we went 5 minutes over. I know some folks have, Dr. Askew, there was one question about, can someone who's already recovered from COVID become reinfected? I know that you may be very anxious for that response.
Another tremendous question. This is the one thing that I've really been impressed by with respect to Prince George's. We are a very savvy community. We ask very smart questions, and we dig deep. This is one of the challenges with COVID. We don't know the answer to that question. We, like most viruses, we would expect that natural infection, for instance, would confer a long-term or even lifelong immunity. Basically, you get it once, you build up antibodies, your body sees it again, can knock it out right away because it's got antibodies, and you never get infected with COVID again. We don't know if natural immunity, if natural infection confers short-term, long-term, or lifetime immunity to COVID, and it's going to be a while before we have that answer. We don't have a vaccine for it, so we don't know that we can even produce a vaccine that can confer lifetime or long-term or even short-term immunity to it. So the short answer to your question is, we don't know. We hope. Because if we're going to rely on something called herd immunity, which is enough people having been infected and recovered and doing well after having been exposed and infected with COVID, that the broader community is no longer at risk, That's what we would hope, which we see with most viruses of this type, but we can't be sure. So that's a great question. And I would, for all of you, keep your eye out on that kind of information, because that's the kind of information that really lets us know how long COVID is going to be hanging out for us, and how long it's going to be an issue of concern.
And I just saw one other question that someone asked about how to get tested. So I want to make sure that people are well aware of the coronavirus hotline at 301-883-6627, and they can call and speak to somebody to help identify the best way for them to get tested, including our health department. You're muted, Karen, or including our health department testing center. So I do want to make sure that people are aware of that, because we talk about mental health, but our basics of life are, and we do want to make sure that we're caring for that too.
Excellent. Thank you for mentioning that.
Dr. Shaw, could you tell me the hotline again, please? So I could just type it in here, because I know some folks are paying attention to the chat box for email and hotline. 301-883-6627. 6627.
883-6627.
Yes. All right. I want to thank everybody for being on today and being patient with us as we got through questions. If you have any other questions, please feel free to email me. I know some folks had questions about housing or policing and trash. Please email me. I work closely with public safety units, as well as our infrastructure and kind of environmental units as well. So I can direct your queries to the right colleagues of mine to make sure we do that. Some folks had questions about addressing FAIR. I know Dr. Askew can help with addressing those questions as well when you send them to me. Ultimately, FAIR is combated by having truthful and consistent information shared as transparently as possible to one another. So I understand that this point of time right now is very stressful and very fearful for all of us. And it is important that we engage each other with honest communication and truthful information that is backed up in actual science and evidence. So I know there's so much out there. I've seen some very interesting bits and pieces here and there about different conspiracy theories and all of that gets your mind going. But please take the advice from Dr. Shaw today. The slides are going to be available if you email me and you wish to look at them time to kind of keep yourself calm and to help support family members as well during this time, and just make sure that we're sharing truthful and consistent information as possible. I'm going to put my email address again in the chat box for those of you who are accessing the chat box. You also hopefully got the email link to email mental health co.pg.md.us. Again, email address for further mental health resources and information is mentalhealth@co.pg.md.us. And you can email there, and I will also work with colleagues to make sure that your queries are answered and resources are provided to you, because it is very important that we support each other during this time and moving forward. This is not just for now. So thanks again, everybody, for staying safe and well, and please continue to do so. I will leave the chat box open for a little while so folks can get the information that's being typed in there of resources. So you can hang out just for a little bit more and write that information down before I close the meeting completely. Thanks again, everybody. Have a great rest of your day.
Thank you.
So long, everyone.
Thank you very much.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you. Thank you so much.
Thank you.
Thank you.
Thank you so much.
Thank you.